So it's really over 2 decades of clinical observation on thousands of female hormone patients. So we just noticed different clinical patterns of response through this process. And so basically, women can be on the same HRT system and have just wildly different experiences. And so we found that some women thrived on a dose and a protocol, and some women struggled on the same thing, and then some barely improved. And so we had to really dig deep as why, what were the differences in these women? So I started to group these women. Okay, so what was it about all these women that were having this experience? What did they eat? What did they do? What did they do every day? What was so unique about this group? What's so unique about these women that are struggling? Why are they struggling? And how are they different than women in, a different category? And then what we eventually came to, what do we do with this category where women are mostly struggling? How can we make their experience better to have a similar experience as a different, let's say a category 1 or 2 patient? And so this is how we've been able to fine tune our program based on, really what is a woman coming in with? Hello, everyone. You're listening to the Me.No.Pause Moxie Podcast, where we strategically challenge the status quo on perimenopause, menopause, and female hormone balancing. I'm clinical hormone coach Marie Hoäg, here with my producer and co-host Maggie Kuhn. Welcome to the show. Have you ever wondered why your friend feels unstoppable on her hormone therapy while you're still waiting to feel like yourself again? Well, this episode is for you. Every woman's body has a distinct hormonal profile, a starting point, and a response pattern. Today, we're breaking down the 5 clinical categories of female hormone patients, what defines each one, how they respond to HRT, and what you can expect as you move through the hormone balancing process to your hormone sweet spot. Hey, Maggie, nice to see you again.
Hey, Marie. I love this idea of clinical categories. It really helps explain why the same HRT treatment can look totally different for 2 women.
Mm-hmm.
So, why don't we just start off with what are patient clinical categories?
Patient clinical categories are something that I put them together about, I want to say 18, 19 years ago when I was noticing patterns of different responses for women. So in advanced female hormone medicine, we use these patient clinical categories more as a classification framework so that we have an understanding about what the patient's hormone balancing journey may look like, and in a way to communicate with other clinicians about the state of the patient's overall health without getting into the chart. So when I refer a patient to a physician in our network, I'll introduce them as this is so-and-so. And in the list of information I send is the patient clinical category. This tells the prescriber, okay, this patient will have this experience. They understand what the patient is coming in with and what the patient's experience like this may be. It also tells us how much hand-holding the patient needs to have during this process.
So that's interesting because I thought that all women pretty much had the same hormone balancing experience, but you're saying, I think, that different women have different starting points. We're not all at the same spot on the starting line of the hormone balancing process. Some people might be at the starting line. Some women might be behind it. Some women might be in front of it. We're not starting from the same place is what I think I'm hearing you say.
That's correct, Maggie.
So, Marie, let's talk about how did the concept of clinical categories come about?
Well, it's interesting, Maggie, because it's something that we stumbled upon clinically. We didn't realize that women responded differently to HRT when we first started getting into hormone therapy over a couple of decades ago. What we noticed was women responded differently to the same HRT system, and we couldn't figure out why. And then when we would go back to the American Academy of Anti-Aging Medicine conferences and we'd ask our colleagues and mentors, why is this happening? Nobody was able to tell us. Like with many things, that meant that we had to try to figure it out. What's different about this patient and this patient that they're having different clinical responses? So it's really over 2 decades of clinical observation on thousands of female hormone patients. So we just noticed different clinical patterns of response through this process. And so basically, women can be on the same HRT system and have just wildly different experiences. And so we found that some women thrived on a dose and a protocol, and some women struggled on the same thing, and then some barely improved. And so we had to really dig deep as why, what were the differences in these women? So I started to group these women. Okay, so what was it about all these women that were having this experience? What did they eat? What did they do? What did they do every day? What was so unique about this group? What's so unique about these women that are struggling? Why are they struggling? And how are they different than women in, a different category? And then what we eventually came to, what do we do with this category where women are mostly struggling? How can we make their experience better to have a similar experience as a different, let's say a category 1 or 2 patient? And so this is how we've been able to fine tune our program based on, really, what is a woman coming in with? Women come in with different conditions. They start hormone therapy on different rates of deficiency or different, I'll say, depths of deficiency. So some women are more recently hormonally deficient, and some have been deficient for years. This impacts the clinical category as well. So it's really just based off of, why are these women different? So it really was derived out of the clinic, just pattern recognition. Like I talk about all the time, how do we figure this out? Patterns, clinical patterns.
Well, and you need to have seen hundreds, if not thousands of patients in order to start identifying patterns, which is such a difference of what you bring to this topic versus a lot of others who it still seems it's quite shot in the dark. I don't think a lot of doctors know why some women respond differently than others. And so I can see how these categories would be super helpful because we're not all starting at the same starting point. We may be on the same therapy, but we're not, as women, at the same point of beginning.
And it's really frustrating. Every time we go back to the conferences and ask around, what are you doing? What do you do when you have this problem? I mean, a lot of doctors don't realize that this is even a problem, because when a patient exhibits any sort of suffering or discomfort, the doctors don't realize that it could be the patient overall health, overall gut health, their sensitivity to hormone replacement therapy, but they're not given answers when they go to these conferences. They're told, hey, well, if your patient still has symptoms and if your patient's still suffering, you can sell them these products. And so this is what happens. And this is why women, when they go to these hormone doctors and they're complaining that their boobs hurt or they're having these side effects or these negative clinical indicators, the doctor's like, oh, well, buy this supplement or take this or purchase this. It's all about the symptoms management through sales of something. It's not about finding out why are 5 different women have different experiences and how can we make this better for the patient and not manage the symptoms with other things. Let's just get this dialed in. A lot of doctors don't realize that it's something that can get dialed in because they've been told that this is where it ends with 2nd generation HRT.
So you're talking about dialed in, which is, I think, another way of saying hormone balancing. Do you just, before we move on, remind our listeners what you mean by the hormone balancing process?
Well, first, women need to understand that hormonal balance is a destination meeting certain clinical criteria. There is a technique and a process to achieve true hormonal balance. It is a 3-phase process. The first few months is the foundation building process. And we'll get into this a lot more. We have an episode coming up here where we talk about the hormone balancing process to the hormone sweet spot and what that might look like for women in any category. So that first phase is really, we're trying to set a foundation of hormones. The second phase, we're fine tuning those hormones. And then the last phase is really where women achieve the hormone sweet spot. And the goal is to maintain that optimal hormonal balance for life. Now, through this process, this happens over several months. And women's experience through this process is dependent upon their clinical category. Say a category 1 patient will have a different experience through this process as a category 3 or a 4 patient. And this is what's explained to the patient so they know, okay, well, this is normal for my category. And I'm on the right track. Sometimes it just takes me to tell the patient, listen, you're doing everything right. Your body is, I know your boobs hurt. I know you may feel a little bloaty, but you're doing everything right. And this will go away, and it'll go away here because this is what's going to happen because you're doing this. And that's what's nice about clinical coaching and working with therapeutic dose HRT is you actually can walk the patient because you know what's going to happen. It's with each category, you know what's going to happen in 2 weeks. So it's easier to explain to the patient why they're feeling the way they are and when it's going to go away and why it's going to go away. And so that helps the patient calm down and to stay compliant with the dietary, lifestyle, and hormone dosing recommendations. So the process is quite a transformational journey. And it's why really coaching is needed, is to hold the patient's hand through this process.
Yeah, I would imagine that, like you were just saying, that this helps you knowing what clinical category a patient is in, helps you guide them and help them know what to expect. I would imagine it's also kind of a shorthand for clinicians for how to talk about patients and how patients are responding differently and what different patients might need.
Exactly. In fact, when I communicate with our physicians, as a coach, I'm texting and talking all the time about patients, and I let them know, okay, remember this patient's, without them having to look up in the chart, I let the physician know this patient is a category 2 patient. They're in phase 2 of the hormone balancing process. That gives the prescriber so much information that they know the patient hasn't reached their hormone sweet spot yet. We're in the fine-tuning phases. The patient doesn't have their full dose of hormones yet. So the doctor has a pretty good idea about what's going on and can help best direct the coach on how to handle the patient's negative clinical indicators.
All right, let's start digging further into the clinical categories. And what determines a patient's clinical category?
You know, we actually had several meetings on this to determine what the doctors take a look at when they're meeting with patients. What do they consider when they do an exam? And so what we came up with was 30 different clinical criteria that we take into consideration when we categorize a patient, you know, from behavioral patterns to their health history and their current state of health. Are they on medications? What was their medication history like? Have they been on a lot of antibiotics over the years? You know, their overall health history. Do they have any conditions coming in? The health ecology of the gut microbiome is one of the strongest influencers of a woman's experience through the hormone balancing process. The toxic burden, how toxic a woman's gut is, her diet, what she eating, her stress load, and her psychological resilience. You know, if women just are really married to being in a place of being, you know, negative, or that nothing ever works for them, and they stay in this mindset of nothing ever works for me and nothing ever will, well, then you're right, it won't. And so we do take that into consideration, and a woman's ability to comply with treatment. And that's why the intake appointments and the consultations are so important, is because the coach needs to know, is this patient in a place where they can actually make this transformational journey? You know, are they in the mindset? Do they still think that everybody is out to get them? Because this is, you know, some examples. Let's just talk about gut health, for example. If your gut health is off, your hormones will not ever get balanced. You will always feel hormonally out of balance if there's no gut changing. And this is what I tried to do. You know, I didn't want to change my gut health and just give me the hormones, but that caused a lot of problems. You know, what a woman eats and her toxin exposure, that affects how her hormones will work, if at all. So what you've eaten and what you've been exposed to, even as a child, what you've been exposed to will impact the hormone balancing journey. Sleep, stress, support, your nervous system has to be prepared for hormone therapy, and that actually begins in the gut. Epigenetics makes a big difference as well. You can inherit resilience and resistance. And so some women, you know, there are just some women that we can't ever get their hormones balanced. And I remember at the discovery of this but I can count on one hand, maybe two hands, how many times this has happened over the past couple of decades. But I try to catch that in the intake appointment. Will this patient be a good fit? We're not interested in making a sale. We want to make sure that we can actually help this person and they're going to be a team player on this journey, because this isn't just about me or the doctor prescribing hormone therapy. The patient has to be compliant. They have to be healthy enough for the hormones, and they have to be in this mindset that they know this is going to work, and some level of trust. If there's no trust with the protocol and the patient's making dosing changes between visits, well, it'll never work. And so, yeah, there has to be the mindset. Negativism will keep a woman from getting her hormones balanced. An external locus of control, a woman won't get her hormones balanced. And we don't bring those women on as patients. It's a waste of time and it's a waste of money for the patient.
That's fascinating to me. And to me, this is how medicine should be practiced, is really taking the individual into account and really truly what their history is and what their attitude is. That's fascinating to me that you're even evaluating things like negativity and locus of control.
What's interesting about that, I didn't know what it was called in the beginning, but I was noticing it. I was noticing there were some women that were so bitter and they were just so mean. And it was like they just thrived on being this person. And these are typically women who came in with a high FSH, that they had spent so much of their life being bitter, mean, angry, accusatory, unhappy, because they've spent so much of their life estrogen deficient, that this is actually who they've become. And then what I found interesting in my research, this is also about the time where I was reading one of Dr. Robert Wilson's studies where he talked about, and he actually wrote about it in the book Feminine Forever, where he talks about negativism. And he even said that there's some women that you'll never get their hormones balanced because they don't want them to be balanced underneath it all. And there has to be a point that the doctor says, you know what, I've done all I can do for you. This is it. This is all you get. So if you think that you can get better someplace else, well, then by all means. But continuing to complain, especially when their clinical indicator score has been suppressed. We have some patients where their clinical indicators, everything on paper shows that they're hormonally balanced. Their lab work is in the optimal ranges. Their clinical indicator score is in the optimal range. There's no reason for this patient to be complaining, none whatsoever, because they're even showing it in their clinical indicator assessment. It's like, so why so unhappy? You no longer have hot flashes. You no longer have night sweats. You're no longer depressed. You no longer have anxiety. You're having sex again. You have energy. What is so bad? I mean, it's just like, there's nothing you can do. So I found it fascinating that even Dr. Wilson discovered this, and he named it negativism. And so this is one of our meetings. I said, okay, figured out this is what it is. It's negativism. It's these subset of these patients who don't want to get better. And they just want to tell their friends that, oh, I've tried everything. I even tried the Hormone Sweet Spot program and see, it didn't work for me. That's how bad I am. So feel sorry for me and don't hold me accountable for my behavior, my outrageous estrogen deficiency induced behavior, because I'm unique and everybody else has to pay the price.
That is indeed a thing. And, I've shared with you that in the past, I helped to create a complementary medicine center with a physician and worked in that for several years and saw a similar pattern. We weren't doing hormone replacement therapy, but we were working with a lot of women who were looking for answers, and those who were married to being a victim, married to being special because of their ailments, were never going to move beyond it, no matter what we offered to them.
Yes. And I did, like I said, that's one of the reasons we have our intake consultations is, will this patient be good? Will they be successful? Can we help them? And most women we can, and that's why we kind of sift out these patients. But usually when you also get those patients when you say, I don't think our program would be a good fit. And then some of them get upset because they really want to do it. And we'll say, well, and I'll tell them, listen, I don't think this would be a good fit because this is how you've handled all the other things. You've never been compliant with any program. If you're not compliant with ours, I don't want you to go around telling everybody how horrible our program didn't work when you weren't compliant with it, because you're probably not going to be forthcoming that you weren't compliant. And so we've been doing this so long, we know what works and what doesn't work. And what frustrates me is I know every physician has these experiences in their clinic. They're not trying to figure it out on their own, because if they did, they would come up with these same things as well. So, yeah, HRT is not for everybody. The Hormone Sweet Spot program is not for everybody. It's for most, but it's just not for everybody.
Well, I think it really gets to that. You have to be a participant in your health, and not everybody wants to do that. There's been a mindset that conventional medicine has developed, that we do this to you, and that the therapy itself is all that's needed, when in fact it really is a team effort, and the patient has a role to play.
Maggie, that's such a good point, because that is really the central point of our program. It's a menage a trois of female hormone balancing. It is not just let's prescribe you hormones and take them this way, and then there's this detachment from the coaching to the prescriber to the patient. So this program, our Hormone Sweet Spot program, is really designed as a team effort. And I discuss this with the patient in our intake appointments as our other coaches. It's like, listen, you are a working component. In fact, you're going to do most of the work. We will recommend what to do. The doctor will prescribe hormones and tell you how to take them. It's your job to be compliant and to follow the recommendations. We've been doing this for a long time. So it would be in your best interest to follow our recommendations and be compliant with whatever dietary and lifestyle changes that we have you make, and the way that you take your hormone therapy. So
I can imagine that, because I think some women want to go rogue and change their dosages in between appointments and drop things. And because I see it a ton in all the social media forums, that women are changing their protocols all the time, trying to.
Oh, yes. I mean, I've dismissed patients because they weren't compliant. It's why it's in our agreement. If you're not compliant with the program, we can't continue seeing you, because we have a technique and a process, and you're not even doing what we're recommending. So there's no reason to continue. And so they're just, when women go on in these social media groups and tell me, oh, I changed my hormone dose last week. And I'm like, oh, that's interesting. How'd that happen? Oh, well, I heard some women wrote that this worked out better for her. And I'm like, okay, well, maybe you should follow her recommendations, because doing what she's doing and what we're doing are two different things. So either you want to get your hormones balanced, or you want to continue to stay on the exercise wheel of this constant adjustment when nobody really knows what they're doing. And then I just learned after a while, it's like, I need to be really careful with who we're vetting into our program, because it's so transformational. And women need to know that, hey, what I'm signing up for in this program is the transformational experience to the Hormone Sweet Spot. They're signing up for the Hormone Sweet Spot. And as I mentioned earlier, it's a technique and a process. And if the patient wants that, they're going to have to be compliant. But it's also part of my job as a coach to walk them through this and help them understand what this process looks like. Well, too, Maggie, it's hard to have that trust when these women have a long history of going to one hormone expert to another, to doctor influencers that are dancing around on TikTok, and they think they're going to these places, and they've just been let down over and over and over again. And I know, for like, you had to make a decision when you chose to go through this program. It's like, do I trust? Do I not? I must have told you something that made you trust me in this, because you had to at some point acquiesce and say, okay, I'm going to do what you recommend, even though the first phase, as you experienced yourself, can be a little rough.
Yeah. I mean, talking a little bit out of the both sides of my mouth, because I definitely had to be an advocate for myself with doctors that weren't really helping me. The ones that I've shared about before that, were underdosing me and trying to get me off of hormones. So I needed to be that advocate. What, I can't even remember exactly, Marie, what you said, but what you said made so much sense to me. And it was an explanation like I had not heard anybody else, and the depth of your experience and your ability to tell me what this journey was going to look like, that we were actually getting someplace, and what category I was and what to expect. That was a different experience than anything else that I had had with a doctor that was kind of like, well, let's throw this at the wall and see if it sticks. And if it doesn't, it's your problem. And I'm so sorry. So it's really a different approach. One question I wanted to ask is that do the clinical categories apply to all of the HRT systems?
Well, yes and no. So the overall health of a woman, no matter which generation of HRT a patient is taking, the more healthy they are in general, the better gut health they have, the better the HRT system they're on will work. However, HRT systems have limitations. And so if a patient's on a first or second generation HRT system, they'll get a better result from that system if they're healthy. But they can't expect to get their hormones fully restored or reach their hormone sweet spot on that first and second generation HRT protocols. So it does to a degree, but the full hormonal balance experience does not happen with women taking first and second generation HRT systems. Even though they'll feel better being healthy when they take them, they will peter out eventually because the brain and body of a woman requires so much more than what those low dose therapies provide for them.
Yeah. And you mentioned this, and I'll just say it again, that for listeners who want to better understand the 4 generations of HRT, listen or re-listen to episode 6, where we go quite in depth into that. Okay. So could you please walk us through the 5 clinical categories and what women can expect from their hormone balancing journey?
Yeah, sure thing. So there's 5, and it starts off with clinical category 1, which would be considered the easiest patient to work with, the healthiest, the easiest. They have a history of a healthy lifestyle and a healthy diet growing up. So they haven't had a lot of experience or a lot of years of their life being unhealthy. They've grown up on a farm to table diet, didn't eat a whole lot of fast food, slept when the sun was down. I mean, just really took care of their brains and bodies through their diet and their lifestyle. They were rarely sick. They were exposed to minimal toxins. They probably didn't wash the dirt off their vegetables when they ate it. I mean, they're just generally pretty healthy. The experience through the hormone balancing process with this patient is pretty steady. The night and day difference with a category 1 patient is not the same as a category 4 patient. This patient's real biggest crime really is the ovaries are failing her, but they've ate well their entire life. They've continued on through adulthood, and now their their ovaries are petering out, and they're starting to feel uneasy for the first time, and they don't like it because they're used to feeling good. So they tend to quickly not wait to reach out because they don't like this, and they know that it's not good, and they know they're doing everything right. So they have to figure out what's going on because it's not necessarily a dietary issue. These women don't, like I said, they don't have that night and day experience with, oh my gosh, that the clouds and the heavens are parting.
You mean when they get onto the right HRT system?
When they start on the right HRT system, because they haven't spent years estrogen deficient or hormonally deficient. So it's not like, oh my gosh, my body has estrogen for the first time. They're used to, they've spent years with plenty of estrogen. So here you're just restoring before it gets too deficient. And so now they have more of a smooth sailing experience. So these women are not going to go on social media and tell you how wonderful their lives are. In fact, they don't spend a whole lot of time because they're living their lives. They're healthy. They're going off and doing things, and typically are focusing on things that improve their health and their lifestyle. And so HRT works real well for these women. They have the least amount of negative clinical indicators, but they're not overpowered with all the positive clinical indicators either. They have a smooth, steady, stabilizing, mood stabilizing, brain stabilizing, body stabilizing experience. Category 2 patients are women who have grown up on a relatively healthy diet and not hardly sick at all, and didn't really start eating unhealthy until they became adults. And they started to party in the 80s and started doing recreational drugs, and bodies breaking down and going on fad diets and incorporating some toxins into their diet that disrupt the gut microbiome. And these women they're not terribly unhealthy. They don't have a whole lot of weight to lose. Like category 1 patients, they typically don't have weight to lose. Category 2 patients, they've gained a few pounds, maybe 5 to 10 pounds. But they notice that the diets that they used to do don't work any longer. And so they're trying to do everything right, but it's not working for them. They're getting headaches, fatigue, their brain isn't working, they're more irritable, they have mood swings, they don't want to engage with anybody, not their family, their children, or their significant other. These women tend to, for some reason, they wait a little longer to start hormone therapy because they've had some conditioning with not feeling good. They have some conditioning with going to doctors that are just managing their symptoms with psychotropic drugs and other things. They're prescribed low-dose HRT that stops working. And so these women are really suffering because they're on HRT and they don't know really what to do, the low-dose HRT, and it's not working. This woman, when you put her on advanced HRT, her experience to the hormone sweet spot is different. She has a pretty good experience, especially if she's compliant with the dietary and lifestyle recommendations, such as, eating plenty of saturated fat, lots of raw dairy and raw butter and animal meats, more of a carnivore diet. So this patient doesn't have a lot of negative clinical indicators when starting advanced HRT. If they do, it's a quick turnaround because they see that any dietary changes or lifestyle changes they make a huge impact on the HRT system that they're taking. And the HRT system is helping them with their energy and their metabolism to lose weight. So these women tend to have a good turnaround time, and they do real well with hormone replacement therapy, especially the advanced protocols. Category 3 women are women who have gained somewhere maybe about 10 to 20 pounds. They have gut dysbiosis. There's no question that they have gut dysbiosis, and it's impacting their hormones. It's impacting their hormone production. It's impacting their sleep. It's impacting their moods, in addition to their hormone deficiencies. So gut dysbiosis also causes depression and mental illness diagnoses, in addition to hormone deficiency-induced mental illness. So these women are really suffering from, and have been diagnosed with somewhere between a half a dozen to a dozen different mental illness diagnoses. They're suffering from depression, and they've been depressed for a while. These women's diets are not good. They think they're eating healthy, but they're not. They're eating lean diets and drinking skim milk and doing all the things that women are told they should do to lose weight, but in reality, it makes them gain weight. So they're buying other products that they're being sold to. So this is just a real nightmare for women that are trying all these different things to be healthy. She doesn't have energy to exercise, and nothing works for them. They'll exercise for 2 weeks when they feel good, and then the luteal phase, they feel like hell. Then they stop working out, and then they just throw in the towel. They're not happy. Nothing has worked so far. These women have struggles, but for me as a coach, if I can get them to trust me, which most of them do because it seems to be what they're looking for, somebody to hold their hand through the process, or like, oh, finally, somebody who knows what they're doing. They're more compliant with saying, okay, I'll do exactly what you say. Just help me out here. Now, the experience of this patient is a little more rough in the first phase because we have some gut dysbiosis. The patient doesn't have the full restoration of estrogen to kick in that metabolism, but it does help in the beginning, or to help turn gut health around. So their journey is a little more challenging through phase one, and their phase one tends to be a little longer than categories 1 and 2 experience through this setting the foundation. Because as we're setting the foundation of estrogen and progesterone in this first phase, we're also changing the gut health ecology, and the patient's incorporating now a regular lifestyle, a good sleep hygiene, and good exercise workout as all these things are taking place. So phase one tends to be stretched out for them a little longer, but it really pays off. Category 4 patients are patients who they have eaten nothing but crap their entire life. They are addicted to sugar. They need to lose somewhere between 20 and 50 pounds. These women typically have a healthy dose of negativism. These women tend to continue to blame everybody for their problems. They have bought hook, line, and sinker that they are broken, that they have mental illness, that these women typically have been diagnosed with massive depressive disorder. These women, a lot of them have been diagnosed with PMDD. They're on multiple psychotropic drugs. They just feel absolutely horrible. They don't even know who they are any longer. They have bought into that this is just how their life is going to be. And they haven't seen anything that would help them otherwise be happy. So they don't really think anything is going to work, because every time somebody said it was going to work and they've tried it, didn't. Their trust factor is in the toilet. And these patients typically aren't terribly compliant, especially in the first phase. The first phase of the process is really rough for them, because category 4 women tend to store a lot of estrogen in their body, in their fat, in their tissues, in their colon, in their gut, because most of the time these women are constipated, and the estrogen that's in their stool that they should be pooping out gets reabsorbed into the colon. It travels back up the colon and into the gut, that further disrupts the gut microbiome, more specifically the estrobolome. And when you give these women therapeutic doses of estrogen, who already are storing a lot of estrogen in their fat, it's too much estrogen for their body. So they have to make some changes before they start advanced hormone replacement therapy. And they don't like that, because women, I've tried diets, I've done this, I've tried this, I've done this, it's never, and they really get discouraged because they feel like they're going to fail again. But this is what's unique about our program. As you know, it's like, listen, the diets that we recommend are not crazy and outrageous. They're lifestyle diets. And you just start with a couple things at a time. And then as the patient starts seeing these changes and they start feeling the changes in their gut, there is a point that we bring the patients ready for HRT. And then you bring on the HRT, and then now everything really starts to take off for this patient. But it's just this beginning, these first 2 to 3 months that the patient has to prepare for HRT. Most women they want something quick. These are also the same women that are not compliant. They are the least compliant, because nothing has worked.
Yeah.
And so usually when I realize in the consultation that they're a category 4, then I really try to steer them someplace else. And then when they keep pushing back to, no, I want to do this, I let them know, really, I don't know if you'll be a good patient. And I'll be investing my time and my energy into this program. And if I don't think you're going to be compliant and you're not, then it won't work for anybody. And then some women really tell me, no, I know this is what I want. This is what I've been looking for. And so when I hear language like that, I say, listen, okay, and then I get really frank on what their journey is going to look like in phase 1, so that they know what they're signing up for. I mean, and most women don't even know what they're signing up for. And so here I kind of give them a blurb on what that's going to look like. So I was a category 4 patient, and it was a pretty miserable experience, but we've been able to dial in the experience for a category 4 patient should we decide to bring them on as a patient.
Well, that's why the coaching, again, is so important as part of this program, because especially I mean, every category needs a coach through this, but especially at this category, and I would imagine category 5, you really need a coach to
Oh, yeah.
cheer you on and keep you going.
Yes. And category 4 patients require the most coaching. And that's why it's a little more expensive to go through. If you're a category 4 patient, it's a different, a more sophisticated program designed for gut healing for the first 3 months, and then into the main program, because everybody is really signing up, Maggie, for one thing. It's hormonal balance. And because of these clinical categories, you can fine tune these programs and the needs of the patient, like coaching. I mean, our category 1 patients, it's like I just review that digital handbook with them and make some points that they need to make sure that they understand. And then category 4 patients, I'm texting, some days texting every day, calling, understand, why is this happening? Why is this happening? Is this going to go away? Is this, it's just my job as a coach to say, yeah, you're actually in the right spot. Your boobs may hurt right now and your ankles may be swollen, but that it won't be in 2 weeks. And this is why it won't be. And then that way they can, oh, okay, I trust the process. Now, category 5 patients are a little different. We had to add this category because this category 5 is not necessarily based off of gut health. The first 4 categories, they're different severity of gut dysbiosis. Category 5 patients are women who are coming in with complicated or complex medical issues, that are coming in with other medical things that need to be managed in conjunction with HRT. Patients with lupus, postmenopausal, severely high FSH women will fall into category 5. Women with, autoimmune conditions, diabetes, things that need to be managed in conjunction. And so when I wouldn't necessarily categorize them as a category 5. This is how we do it clinically. We would categorize them 1 through 4 according to gut health. And then if they are, for example, I have a patient who is an amputee and she's diabetic. And so she would automatically category 5. We have some things that we're dealing with her. She's a category 4, not necessarily because it's her own fault. It just, she is. And so we use an indicator of a plus for this category to indicate not only is she a category 4 patient, we add the plus sign to indicate that she's also a category 5, and this is why. So when I send the chart over to the doctor saying this is a patient, she's category 4 plus, and then I explain the category 4 and how we're addressing it, and then I explain the plus, like this patient's had 2 amputations on the same leg, the patient's pre-diabetic. And then I explain that so that the doctor understands, okay, I have a category 5 patient. I need to manage these things for this patient. So category 5 doesn't necessarily fall into the gut health stages, but it does tell the patient, listen, it's not just HRT we're managing here. We have to manage these medications and your conditions along with this HRT, which will influence your other conditions. So it gets to be a little complicated. That's why we have functional medicine doctors and internal medicine specialists on our team, because we need to understand this differential diagnosis when it comes to these category 5 patients and how we can best serve these women.
What can category 5 expect could be the results for them?
I would explain to the patient first their primary clinical category 1 through 4. Then when I explain the category 5, their condition, I'm talking about their condition now. Mm-hmm. So first I talk about their gut health, the category 1 through 4 that they are. And then I talk about the category 5 in that the condition, let's just say the patient has a thyroid. So thyroid would be a category 5 person, because not only do you have to manage estrogen and progesterone in phase 1, you have another hormone that needs to be fully restored at the same time. When a patient has a thyroid deficiency, you have to restore estrogen, progesterone, and thyroid simultaneously. You can't just do the estrogen, progesterone, and then add on thyroid later. So no, this now turns this patient to a little bit more complicated, because fine tuning those hormones is slightly more complicated than a patient that doesn't have hypothyroidism. So I'll talk about that in addition.
Yeah, I can see how understanding for a patient to understand their clinical category can really help a woman know and understand what their roadmap might look like and what the expectations are and help them also to have patience and stay compliant.
I mean, I was so frustrated in the clinic before we were figuring this out because I did not do, because I told you I was a category 4. I was not an ideal patient. I had severe gut dysbiosis, but I also watched women just go through and they're just like doing real well. I'm like, why are they? Why are they? Why are they? And one of the doctors I work with, I talked with a lot during the day, and I would say that I don't get it. Why am I having these negative clinical indicators this severely, and we're on the same HRT system? And I kept dismissing what this one doctor was saying, but the way he said it always irritated me, so I would dismiss it. He would say, it's because of the health ecology of your gut microbiome. I'm like, oh, gut bacteria, come on, just give me the hormones. We didn't really know at that time. They weren't even talking about this 20 years ago, the influence of the gut microbiome and its influence on hormone therapy. I mean, we stumbled upon that ourselves too. So I didn't want to listen when the doctor was telling me, well, you have to change your gut health. You have to change your diet. And I was so addicted to sugar, the thought of that freaked me out. I'm like, are you kidding me? You're asking, you don't think you understand what that's what I said to the doctor. I don't think you understand what you're asking of me. It's like telling a heroin addict to, okay, you just have to stop taking heroin before we do this. Yeah.
Yeah.
Like, really? Like, the addiction was so strong, but I did take the therapeutic dose HRT without changing my gut, and I made matters so much worse for myself. And then I started looking at these category 1 and 2 patients going, okay, sister, what are you eating? What are you doing? What do you eat? And so we started to learn what diets worked because we started to discover some diets make things worse. Some diets are ideal. And so then
Yeah,
we started,
you've mentioned before that if someone's vegan, this doesn't work as well for them.
nope. And this is how we figured it out. It's like, why are these women so? Because when we were categorized a patient, I said, okay, you're relatively healthy. You don't need to lose weight. You do all the right things. You eat organic food and, you don't take antibiotics and, but then we didn't realize that we just thought, okay, vegan, oh, no big deal. Oh, because that's what they were teaching us at the conferences, the more vegan, vegan, vegan. But we found that the more vegan patients ate, the worse their hormone, the harder it was for us to balance our hormones. But we didn't, this was more of a thing that we figured out a little later on. It's like, why is this category 1 patient not doing well? So now we're doing this micro looking into category 1 patients. So we have a group of category 1 patients that aren't doing well. Why is that? Well, what diets are these? Oh, guess what? These women in category 1 that aren't doing well are on vegan diets. Let's change this and do blood work. Because we take blood work, as you know, Maggie, once every 4 months and a clinical indicator assessment, because it takes about that long to see any clinical changes of a dietary change, a supplement change, a medication change, a hormone adjustment. Then we started to notice improvements with hormones in the clinical indicators that patients were having when we switched them over to a carnivore diet. This is how we found out, we have about 6 different diets that women do well with hormonally. And so we pick one that the patient will be the most compliant with because that's the most important. Will this diet support advanced hormone replacement therapy, or will it completely flush it out of a woman's system? Because like I've used this analogy before, you give a vegan HRT, it's like, living in Dallas in August with your windows open and your air conditioner on. It's like, you're barely going to get any relief. It's like you're just flushing everything out of your system. And we didn't really realize this was the thing. Nobody gave us answers at the A4M on this.
Hmm. A big takeaway for me today on this, Marie, is that it's not just about the hormones. It is about the woman behind them and what's the starting point that we're each coming in with.
Yeah, overall state of women's health. That does. What canvas, because I've heard the reason I did this, because I hear the doctors in the clinic going, what are you handing me? What are you giving me? Like, give me a healthy patient I can work with. This is what some doctors, and then some doctors like, okay, can you just refer to me only category 1 and 2? Because it makes their job of hormone balancing easier. And this is like, oh, this is a big deal in hormone balancing. Oh, guess what? We'll have a more successful practice if we only brought on categories 1 and 2 and possibly 3 patients. But the majority of women who are out there, especially perimenopausal women and menopausal women, are in category 4 because they've spent so much of their lives estrogen deficient and on these fad diets and on these low dose therapies. So that's why we have our panacea hormone diet. So, and that's so that we can send these patients to our HRT prescribers saying, look, we are giving you a relatively healthy patient to work with. Let's all work together now and get this patient as healthy as possible.
So, and I really want to emphasize that there is hope for a category 4 or 5. You know, you're living proof of that, and so are many of your current patients. So it's not to say that it's not going to work. It just is going to take more commitment and dedication and willingness to follow the protocol.
Yeah, and I think it's more too about women just want to know what to do. They don't want to have to figure it out on their own. They don't want to have to walk into their doctor's office saying, oh, can you prescribe me this at this dose? Like, who's in charge here? So yeah, women are looking for somebody. Oh, you have a technique and a process. I just want my hormones balanced. Can you do that for me? I don't care how many appointments it takes. I don't care. I just get my hormones balanced. I'll do whatever you say. Just please. Okay. You do this, take this hormone replacement therapy. This is what the process looks like. And we're looking at the hormone sweet spot in this amount of time. And our goal is to fully restore those hormones into a state of a optimal hormone homeostasis. And then the goal is for the patient to live in this hormone harmony for the rest of her life. And it's doable for a lot of women, really, no matter what category. Even category 5 women who have severe conditions, even if they can't get on an advanced HRT system, we can even get low dose systems to give some real good support along with diet and lifestyle. So it's hard for me to turn women away because I know what we can do for them. But if I don't think it'll work out, even though I know that this is the only, I know that this is what they're looking for, and it's really the only thing that will save them. If I think they're not going to be compliant, I won't encourage them.
Yeah.
It's for most, honestly, no matter what clinical category a woman is in, Maggie, she benefits from therapeutic dose HRT. And the categories are just a way for women to understand what your process may look like and to help you understand what you can do to take yourself to the next level and to make your hormone therapy work better. And I may have told you this in our consultation. It's like, we'll give you HRT, but the health of your body, you are given these hormones a healthy body so they can work right. It's like a gift you're given to your hormones so that your hormones can work for you and then take you to the next level. And that's really how it works.
Yeah. It's so complex and detailed and nuanced. And at the same time, you know, you really have a methodology. And I think that provides a lot of confidence in the process and getting to the hormone sweet spot. I guess I would just say for our listeners that if today's episode helped you see your hormone journey differently, definitely share this with other women who you may know who are struggling, to give them hope and give them some encouragement.
Oh, certainly. Hey, and also, if you want to know what your clinical category is and what your hormone balancing journey may look like to the hormone sweet spot, start with taking the hormone balance test. You can go to thehormonebalancetest.com. You can fill out, this is what we refer to as our clinical indicator assessment, and you can have a pretty good idea about what your clinical indicators are. And then you'll have the opportunity to book a discovery session with one of our clinical hormone coaches that will review your hormone balance test and to see if full hormone restoration or advanced hormone replacement therapy is a good fit for you. Because every woman really does deserve to achieve hormonal balance, not half answers and not low dose band-aids. So your body can do extraordinary things. You just have to have enough hormones to give it permission to do so. Thanks so much for joining us today. And remember, everybody benefits when your hormones are balanced. I'm Marie Hoäg, and this is the Me.No.Pause Moxie Podcast.